It's time for another ProNex Inc. Podcast, and I'm here to share that with you. My name is Karol Clark, and I am the host of the show. And I'm excited to bring on someone who has recently made a transition we'll talk about and who has chosen ProNex Inc.'s lifestyle medicine, the CORE LMP software platform. So let's dive into why that is and some of the details about why this is such a great option for anyone who's practicing lifestyle medicine. Welcome back, everybody. We are back with Dr. Chu, and we're switching gears a little bit from her transition from bariatric surgery to managing lifestyle medicine, longevity, obesity medicine in her practice in Louisiana. And one of the things a lot of people may or may not know about you is your interest and your talent when it comes to technology. Can you talk a little bit about your history with technology and how you've decided to use that in your new practice, Chu Precision Health, there in Louisiana?
So I started general surgery about 24 years ago, and then bariatric surgery. And back then, we needed a lot of, we wanted to really track bariatric surgery results because it was so new. And I was kind of a technology geek, so I wrote my own little database program using what they had at Microsoft. And so we were able to track. And then I met ProNex with Fred, and he was able to offer us a really amazing EMR solution that would allow us to track our patients from the initial phone call until the day they have surgery and analyze some of that data. And then, of course, long term, we were able to track their outcome seamlessly with one platform. Fred really worked individually with us and gave us pretty much what we needed. So it was a great product. I've been practicing in a big hospital-based system with Epic, and we have clinical directors, office manager, head nurse, medical assistant, a whole team of people to help deliver this care. Recently, I decided to transition over to just lifestyle medicine, and just because I felt that there was just so much more that I could do for my patient if I could focus on helping them with their lifestyle changes. And that just became my interest over time. It just seemed more exciting and more complex and more complicated than surgery, which I've had a great, amazing career with surgery. So I called it Fred again. I said, Fred, I need something to help me as a solo practitioner deliver this lifestyle medicine in an intense fashion where the patients know that I'm with them at all times without a large staff. So here we go. Fred, of course, says, of course, we can help you with this. So what we created is a platform where the patient can sign up from my website and they make their own appointment. I send them the intense questionnaire that we need to have to kind of dive into the root cause of their problem from their birth to their childhood to their childbearing age and, on the different phases of their life. It is a kind of intense survey that you don't see at most doctors' offices because of the importance of the patient's journey to allow me to help them through. So one of the major complaints is the intense survey, but they love the system because it was so easy without a lot of phone calls, without a lot of back and forth. They're able to upload all their labs and all their doctor's appointments or notes themselves. And so once they come to the office, I have everything I need. So there's no need for my medical assistant to track down data, track down labs and all that. So everything is there, and we're able to have an amazing visit. And then with AI on board, I'm able to capture the visit completely. And then the amazing thing is the ability to assign them educational materials that I know will go straight to their inbox. And I can view to see if they actually open up the material. And then I'm working on a post quiz to see if they can understand the material. So that's in work in progress. I can give them some actions that they can do, like, going to sleep on time, or, drinking more water. And these actions the technology will be able to remind them. Yeah, it's kind of a nuisance, but that's what technology is there for, remind them to follow their actions. And, if they're not, we have a place for them to kind of make comments and communicate with us. But I try to enforce the importance of communicating and letting us know, because, no one's perfect. We all have our ups and downs in our situations. So the technology is able to help me remind them to do all things that I couldn't do without a full staff of, support. The other amazing thing is being able to see all this on a dashboard when they come in, so it makes the delivery. We're trying to integrate some by wearable where I really can tell if they're lying or not, but for now, at least I have a little bit of a vision of what happened between our office visits, our clinic visits. And then the other thing is being able to have virtual visits and televisits, so I can go into their home and really get to know them if that's necessary.
Right, right. And you mentioned earlier the software patient flow is the sort of the software earlier that you used in bariatric surgery, which had to do with tracking the patient, improving conversion rates, being able to monitor their compliance with all the insurance requirements. I know, just to touch on that real quick, we use it in our practice as well for bariatric surgery, and boy, did it make a difference for the team, because all the communications in one place, you can securely text and do all of that to make sure that they can move through that whole system. And I love how it has transitioned into that was patient flow, which is still, of course, available to bariatric surgeons and programs across the U.S. and used widely. But now the new platform, the one for lifestyle medicine, and the CORE LMP, I love the fact that you can actually, you've been very instrumental, but I've gotten to see the back end of it. So you can actually prescribe and track patients' interaction for all 6 pillars in one place. And for you personally, you're actually able to use it too as your EMR, as many will be able to likely do as well. So can you talk just a little bit about the importance of prescribing the 6 pillars, prescribing the treatment plan for the 6 pillars, and then how the patient can interact with you through their dashboard as well, so that you can track them real time and automate some of that messaging you were just talking about?
Yeah, so traditionally, like I said, I've been on Epic before. They would come to us with a problem, heartburn, hypertension, cholesterol, and we would prescribe them the medications. And when they come back, it's like, did you take your medications? And it's like, well, sometimes I did, sometimes I didn't. So with lifestyle, it's like, let's get 10 minutes of walking in every day. Let's eat a little bit more fruits and vegetables. And then, you leave, then the patient leaves your office and you don't see him again for another month or 2 or 3. So with lifestyle medicine, you really have to have the ability to stay on track with these actions. So the CORE LMP is able to make that process more precise and more intimate with the patient, so they're feeling like their doctor is watching, or really cares that they're touching base with them. So we're able to prescribe the 6 pillars of lifestyle medicine, which is, nutrition, activity, sleep, stress management, decreasing risky behavior, and social interactions. So being able to track those 6 pillars and making sure that they're on top of it is something that the program will be able to help providers do, because sometimes we get focused on fitness or our strength in nutrition or fitness, and we forget about the stress management part. So yeah, so the program kind of helps make sure that you touch on all those different things. And they have true EMR functionality, so you can order your labs, you can prescribe medications, and then we have ability to track the injectables too, to kind of remind them to take their injectables and any of their weight loss medicines, so that if they have symptoms or nausea or some concerns, they can message it will alert the practice, letting us know that they're having issues with their medications. So that's really exciting for me, is the ability of the system, because the bigger system, I don't, it's really hard to get it to do it. I don't even think you can do that. But so that's one of the things I asked Fred to do, is like, we got to be able to way to track them, make sure they're taking this medication, and be able to know if they're having side effects without waiting for a month or 2 or 3 for them to come back and say, hey, I just stopped taking it. It just didn't make me feel good. So that's the exciting thing about that. It's just, like I said, lifestyle modification is a lot more challenging than prescribing them a heartburn medicine or a blood pressure medicine. So I think this platform is really going to be critical in helping lifestyle medicine doctors.
Yeah. Yeah. I love the fact too that it's been created, developed, and tested by obesity medicine specialists and specifically lifestyle medicine practitioners. So it's not something that's being used in practice and receiving rave reviews, and really something that's making a difference for these practitioners, so they can do everything in one place. So it's awesome that you've been
Yeah, it's really exciting to be able to make this transition without, like I said, needing a huge staff to carry through with all the tasks.
So for your practice, it sounds like it's working out very well, from all the different softwares you've looked at, and then really finding something that's going to work really well for you and your patients.
And my patients love it. They're like, we've never seen anything like this. Did you create this? I said, well,
yeah,
I had a part in it, but we just had a great company that was able to listen and deliver what we needed specifically for us.
Yeah, yeah. So it's called the CORE LMP by ProNex. And in a nutshell, can you just tell me maybe the top few advantages for practitioners, and then the top advantages of this particular software for patients?
I think the greatest advantage is being able to prescribe the 6-pillar lifestyle changes. And there's also a database of educational handouts and videos to help you deliver that in a more efficient fashion. And then secondly, being able to track the patients so that they know that you're listening, and then being able to program a weekly, recommendations or tips on how to do well. And then the third would be the ability to track this anti-obesity medicine, being able to stay on top of that. And then having the ability to see their progress on a dashboard when they come in. So it just makes the process a lot more efficient.
Sure, sure. And from the patient's perspective, you said your patients are so excited. What are they most excited about?
I mean, just the ease of use, especially from their portal, being able to communicate, send messages, upload labs, see their progress, and track their activity, track their sleep, and trending it and all that. So all in one place, instead of having multiple apps from, we have lots of apps and wearables these days.
Yeah, it helps your small team be mighty, huh? You can have a small team but still be mighty, watching everything in one place. Yeah, well, that's exciting. I love your background with technology and your ability to help create something that is obviously very user friendly, and something that's very, practical and works with different flows, because every office has a slightly different pathway, so to speak, but it's working well for anyone who's delivering lifestyle medicine and obesity medicine. So I'm excited about that. So good things to come. Any other final thoughts before you tell us how people can get in touch with you?
Well, I mean, another thing is it's very customizable. Fred's been able to customize to meet your office workflow. So that's really, so it minimizes the disruption to your workflow too. So yeah, I'm very excited about it. I think it's going to be a great lead in delivering this lifestyle medicine. They can get in touch with me through at chuprecisionhealth.com.
Awesome. Well, very good. I really appreciate your time. I know you're really busy during this transition and beyond, and with all your software development, all those sorts of things. I know it's a busy time. So thanks for taking the time to share all of that with the audience.
Thank you very much, Karol. Appreciate it.